Welcome to Uncommon Analysis. Today I want to take a few minutes to talk about healthcare system in the United States. Since the murder of that health plan executive by this pathetic little punk, and make no mistake about it, folks, this guy is a murderer. He's not a hero. There's nothing heroic about what he did. There's nothing noble about what he did. Just another left-wing wackadoo who decided his desires are more important than anything, no respect for life, and decided, I'm going to kill a man in cold blood. And that's what he did. And the media continue to lie about it, which is beyond the pale. If you find any reports on this execution, and this is what this was a cold-blooded execution. Even though the videos, they may even mount the live video, they may even show the video in the article, they'll still talk about how this man was shot twice in the chest. He was not shot twice in the chest. He was shot twice in the back by a little pathetic coward who thought he was a big man. Some left-wing, overprivileged punk, wackadoo, never done anything with his life, decided, I'm going to kill someone because I believe their death is worth it. What I'm fighting for is more important than their life. And of course, when he gets caught, let's guess what? He's a shivering, conniving little crying coward who pissed his fucking pants. Look at that. This is no hero, okay? But I digress. I don't want to go off on that. That's not the point of this video. But since that has happened, I've seen so much garbage and so many lies and so much misinformation being spewed about the U.S. healthcare system and how it operates that I think I have to at least offer some insight. And I do not offer this insight I do not claim to be an expert. I am not an expert on healthcare. Okay? But I am just seeing things I know to be utter lies being spewed about this industry. So let me put some context around me and where I'm coming from. As most of you already know, I'm a very conservative individual. I definitely am on the right wing politically. I tend toward libertarianism. Live and let live and leave me alone. That's my general default factor. I'm a capitalist. I do believe that capitalism works for the most part. But I am not so naive anymore to believe that capitalist principles and free market pressures can fix the U.S. healthcare system. Why do I say that? I used to believe these things. I used to be very, very naive. I had all the talking points, because, my worldview is pretty much laissez, faire capitalism for the most part. Capitalism is not perfect. It does have its downside, and we need to be aware from it. And those of us that advocate capitalism need to accept these limitations of it and not dismiss it. Because when we dismiss the limitations of capitalism, the problems with capitalism, we're no different than when the left dismisses, like, the border issue, right? Oh, that's a right-wing propaganda thing when the right says something. You're doing nothing different. Capitalism is not perfect. Right-wing ideology is not perfect. The world is not perfect. This is a complex problem. You're not getting a bumper sticker solution. All right? Anybody selling you a bumper sticker solution, whether it agrees with your political ideology or opposes your political ideology for health care in the United States, is an ignoramus or a liar. Take your pick. Because you got to be one of those two things to believe any sort of bumper sticker solution is going to actually work. Okay? So that's where I come from. Now, how did I lose my ignorance on healthcare and that just pure ideological driven worldview? I lost my ignorance on how healthcare works in the United States by working for almost a decade in two different, very large, integrated health companies. And what do I mean by saying integrated? That means, in the health care parlance, in the health insurance world, an integrated company is a company that provides both health insurance and health delivery. I worked for two of them, two very large ones, over the course of a decade. And I learned a lot. And I was not in the trenches. I was not actually in the hospitals or in the doctor's offices delivering care. And I was not calculating actuary tables and selling health insurance either. I worked in the IT of these companies. I worked helping them get the data and information they needed to the right places at the right time. And all kinds of other stuff along those lines. And it didn't take long for me to understand that healthcare in the United States is not a market-driven industry, and it will never be. Market forces in healthcare are limited. They're limited in what kind of effect they will ever have. And it's for many, many, many reasons. And there's no way I'll have time to talk about all of them because there's hundreds of them. And I don't feel I'm an expert enough to talk about all of them. I can say that I observed and witnessed a lot of them and concluded that, yes, this is not a market-driven economy. Sorry. Excuse me, I've got a cold here. So this is not a market-driven industry. So when you read an article like this, and there's a lot of articles out there right now, there's a lot of articles that say, hey, insurance is what makes you, and that is a contributing factor. Yes, third-party payers are a factor, one of hundreds, if not thousands, that affect the cost of healthcare in the United States and healthcare delivery. I know there's a push, open pricing, right? Like upfront pricing. That's another one. The right-wing ideology likes to believe. If we just had upfront pricing, people would shop and they would pay. Well, no, yes and no. Yes and no. And I'll get into that in a little bit. So, right I have in front of me is 5, and I may go into more. 5 things off the top of my head that I'd like to just talk about. Well, first thing I got to do before I even get into those 5 things is I want to explain how health insurance works in the United States at a very high level. Not every detail of it, but I want people to understand because there's a lot of ignorance that came out of this after this guy was murdered. Understand, the law in the United States is if you're a health insurance company, you have to pay out 85% of your premiums. Period. Okay? The health insurance company gets 15% of their premiums to operate in. That means that they have at absolute most, 15% of their total premium revenue is where they have to cover all their expenses and make their profit. Okay? Period. I don't care what your health insurance company is. I don't care if you're... this is not meant as a defense of the practices of every health insurance company or in any way a defense of health delivery. This is just offering you facts. Okay? Now, I haven't checked that number recently. It's been a few years since I was up to date on these things, but the last time I saw 85%, that was the federal law. So if you paid $1,000 into your health plan every month, $850 of that $1,000 was spent by the health plan on reimbursing claims for other people that have that health insurance. It could be you or others, okay? Understand that. Okay, that $1,000, that company at most, understand, that's a minimum. There is no maximum. The law just says you have to pay out at least this. You can pay out more, but you have to pay at least this. So that $1,000 premium you pay a month, that health insurance company operates on 150 of that. Okay? That means all of its expenses related to that health insurance operation come out of that $150 and its profit. It's not $150 in profit. They got to operate everything. That means they got to pay all their salaries. They've got to pay all their overheads, all their regulatory costs, all of their real estate, whatever it is. Anything that they've got to pay out of pocket, that they got to pay to operate, to exist, comes out of that 15%. Okay? So even the most quote-unquote evil health insurance company at most can only drive down how much they pay out to 85%. No matter what they do. Because if they go beyond that, they violate federal law. Now, you could argue, oh, well, they're violating it and they're not enforcing it. That's a different discussion. Okay? If you have proof of that, then I'd suggest you contact your FBI and law enforcement, federal law enforcement, and turn in your company if you believe that's true. But that is the law. Okay? So understand that. There's only finite amount of resources. I don't care what insurance company comes. Even if they spend 90% on reimbursed claims and are efficient enough to operate and make a profit off only 10%, it's finite. The amount of money in the pool is finite. You're going to have denied claims. You're going to have things that are just not approved. It's just the way it works. It's finite. It's not infinite. Okay? That doesn't make them evil. And I'm not saying that there aren't some that are indeed evil. I mean, I've seen some very, very evil, horrible things happen in healthcare, and we all know about them, right? We all know about them. I'm not defending it. I'm just telling you this is the reality. Okay? So if you take nothing else, understand that. So, when you say, oh, these greedy corporations, I'm not saying greed doesn't drive decisions, and I'm not defending every decision ever made in a healthcare company. They can be ruthless. Okay. Secondly, you've got to understand is that insurance by its very nature is a socialist construct. You are socializing the risk. So free markets in a socialist construct is kind of a comical thing anyway, right? All insurance is a socialist contract. All of it. You're socializing the risk, whether it be car insurance, general business insurance, liability insurance, or health insurance. All insurance is socializing the risk. And what does that mean? Well, you can Google it, but a quick 5-second thing is everybody plays in the pool, so the pool has enough money to pay out the people that need it. You're pooling your resources to protect the greater pool, right? Everybody's throwing into the pool, so resources that help them when they need it. It's not one-to-one. It's not I put $1,000 in, I get $1,000 out, right? I put $500 in my car insurance the last year, and I took $500. That's not how it works. I put $500 in, so I could have coverage. So if I needed it, I could get potentially hundreds of thousands back. But if I don't need it, it goes in the pool and goes to other people. So it's not I pay X, I get Y. That's not how it works. It's a social. They are socialist contracts. Period. You're socializing the risk. Accept it. Okay. Now we're gonna go through the 5 things. This article here, and there's been a lot of them, but this one's talking about how healthcare prices are so high because of, and basically this argument is third-party payer, which is health insurance companies, and that's true. There is an insulating factor in the fact that the insurance company pays the bulk of the bill. You don't know what it costs. You don't care what it costs because you're not paying. You're paying your deductible or some copay, but the majority of it's being paid by the insurance company. So you're less likely to shop around and find the cheapest price. There's a logic to that argument, and there's a truth to that argument. But there's also some counters to that argument in that healthcare doesn't work like most things. Okay, I'll get to that in a little bit. That is an issue, but it's hardly the greatest issue, and it's not by far the only issue. Okay? Secondly, you're going to see a lot of articles and a lot of push. Upfront pricing, clear and invisible price, or clear and transparent pricing. Okay, healthcare is not a widget. It's not a piece of gum. It's not a radiator. It's not brake pads. Okay? Healthcare having upfront pricing can't happen for all things. For example, if you're a relatively healthy person with no comorbidities and you walk into the doctor's office and you're diagnosed with a upper respiratory infection or pneumonia, something along those lines, right? Your prescription, your treatment may be nothing more than here's some cheap, readily available antibiotics, a prescription for that, bed rest, and drink lots of fluids. Excuse me again. Now, someone who has chronic asthma or some other respiratory issue goes into the doctor's office and is diagnosed with the exact same problem. Their treatment may involve hospital stays, very expensive, rare antibiotics, and physical therapy and other things. How can I upfront price that? How can I say, hey, if you get diagnosed with this, your charge is $50? You can't. Now, MedExpress, they'll treat you, and I get that. Okay, they have upfront pricing, and some things you can't. But across the whole, you can't do that. You can't say, okay, you're diagnosed with X, therefore this. It's just like the stupidity of the one group that up until this murder, I forget which one of those, Blue Cross, maybe one of the Blue Crosses was going to say, we're going to pay you for X amount of dollars for anesthesia period, regardless of how long that patient actually is under anesthesia. Right? Because complications happen when you're in surgery. Things happen. Not everybody is the same when it comes to healthcare. Not everybody's needs the same. Not everybody responds the same. The first course of treatment or the recommended course of treatment that you do your actuary tables on doesn't work on everybody. Some people can't have that treatment. That treatment may cost X, but some people, due to other complications or other issues, can't have that. They have to have a different, more expensive treatment. So upfront pricing, transparent pricing, it's fairy tale. Yes, I'm not opposed to saying having those things, but to believe that's going to massively shift the industry is just nonsensical. It's ignorance. Next item is that healthcare is not a market-driven industry. Okay, it's just not. Anybody telling you that it is either full-on ignorant or a liar. Okay? You may want it to be. Certainly, you can try to use some market forces to play some things, but the idea that you're going to radically change and fix the market with the healthcare industry with market forces is just comical. It's just rainbows and unicorn sparkles. That's all it is. Don't like it, but that's a fact. Fourth, the United States healthcare system, while not technically a single payer, in all actuality, in many ways is. Okay? Why do I say that? Because I know something most of you probably don't know. And this is something I hope people pay attention to. Studies have shown, on average, 80% of what you spend in your life, or gets spent on you by a third party, in your life for healthcare, will be spent in the last 2 years of your life. Let me repeat that. 80% of all the money that gets spent for you to receive health care, go to the doctor, get treatments, see specialists, hospital visits, whatever it is, 80% of those, what is spent on you on average, on the average American, will be spent in the last 2 years of their life. And most Americans, those last 2 years of their life are going to be while they're on Medicare. So Medicare is by far the single biggest payer. By far. It's not even close. In the United States. They represent around, I believe, 80%, give or take, of the revenues in the whole industry. So even if you countered those several arguments I made before and said we use market forces somehow to just fix all those things, which I've already said you're not going to, you're still only affecting about 20% of the market. You're nibbling around the edges, even if they worked. Even if they work so well that they have the cost of everything, which is unrealistic. You're still only nibbling around the edges. So this, while nice sounding and well received for certain people, market forces can fix the economy or fix the healthcare system in the United States. That's a naive belief. It's a bumper sticker solution to a complex problem. It will not work. I'm not opposed if you want to try. I'm not opposed to saying, and you can nibble around the edges. I'm not saying you can't improve some things with market forces, but the idea that you're going to fix the U.S. healthcare system with market forces and that alone, you're lying to yourself. You're either an ignoramus or you're lying to yourself. Because 80% of the revenues in that industry come from one payer, Medicare. Roughly. That drives this industry. It is a regulatory-driven industry, not a market-driven industry. Okay? You have to understand that. And most people, I don't think, get that or don't like to hear it. Okay? Number 5, when you are the person making the decision, it's your life on the line, which it can indeed be. If I present you with option A, which is 10 times more costly, but has an 80% chance of success, or the more traditional accepted path of treatment, right, which is a tenth of the cost, but only has a 50% survival rate or maybe even a 30% survival rate, and you're in that situation, which one are you going to choose? Most people are going to choose the much more expensive option because it's their life on the line, literally. These are life and death decisions for some people. This is not a market-driven, that top-line brake pad costs $100 and guarantees me 30,000 miles of wear, whereas the next guy down is, I don't know, half the price and gives me half the wear. So therefore, I'll just do that, or maybe even less than half the way. I'll just do that for now because I can buy it later on. That's not how it works. That's not how it works. Most people are going to choose the option that gives them the best result, or they believe will give them the best result, regardless of cost. Regardless of cost, if they have the option. So stop it. Stop with the naivete of this. Now, there are hundreds and hundreds of more I could go into. I don't have time. I don't want to make this an all-day thing. But the important takeaway from this is I want people to understand, while it sounds great and it plays well to people with a certain ideological bend, that market forces can fix the healthcare industry, I am telling you point blank, it won't. Oh, and by the way, you know that Medicare folks that are the biggest player in the market and the big gorilla that drive everything, they actually have they're actually, when surveyed, people like them better. Medicare does better, has a better approval rating by its users than most private insurance companies, by far. By far. So those that the private industry can fix this, just keep that in mind, okay? Keep that in mind. And it's not even close. It isn't like, oh, the Medicare recipients rate their Medicare coverage and experience a couple points better than most private insurance. I mean, it's tens. It's a huge factor difference. Okay? A huge factor of difference. So I hope that gives you a little more insight. So when you read these articles, and articles like this, or the dozens more that are coming out, now because there seems to be a push that market forces can fix. And again, I am generally a laissez-faire capitalist. That is my general go-to viewpoint. And I was naive enough to buy into a lot of this stuff until I actually worked in the industry for almost a decade. I can tell you, it's just not true. You're not fixing the industry with market forces. It's just not true. Oh, give everybody an HSA and let them pay for everything out of pocket. Okay, you do realize, as I said before, $40,000 to $80,000 median income for an individual is what, $40,000 or less. Median household income is $80,000 or less. How much money do you think you're putting in an HSA? $8,000 a year. If you're really making it a priority, you put 10% in there. One event wipes that out. One. Even if you cut the prices of healthcare in half, which would be impossible because the overheads won't allow that to happen. But even you said miraculously, okay, the cost of healthcare now is half for everything. One event, boom, it's gone. Well more than that. So let's stop this nonsense. You're going to need insurance. You need it. There's no way around it for the typical family to feel safe. You're not pay-as-you-going. You can pay as you go mostly. If you're healthy, if you're lucky and you're healthy, right, and your health insurance needs or your health delivery needs per year are a couple of physicals, right, and you're healthy and you're young, you got good you won the biological lottery, sure, you can pay as you go as long as you don't have a big problem happen to you. But the minute that ends, you're not going to have it. Most people are not going to have the resources. We all know people, if we've been around and have a big enough sphere of influence, we all know people who have faced very big hardships due to healthcare issues, right? If you've taken care of your parents, or you've taken care of a loved one, if you have an unhealthy child, this is the reality, folks. Stop being naive, okay? Stop being naive. I know there's a push for it, and I'm not opposed to trying. But again, like I said, 80% of it's coming from the government. It's coming from Medicare. So all these things they're trying to advocate and say it's going to fix the system, it's nibbling around the edges. It's not going to have massive impact. It can't fix the industry in and of itself because the problem is not one singular thing. I just went through 5. There are hundreds, and I don't claim to be an expert. And I think most people that are involved in approving these regulations probably don't even know the 5 things I just listed to you. They probably off the top of their head. People that are voting on regulations and legislation regarding health care, I bet you less than half of them know those couple of facts I pointed out to you in this one little article. All right, guys, that's it. I could go on, but I think that's enough for today. Hope you have a great one, and I am out.